Welcome to our comprehensive guide on lung function tests. In this video, we'll explore the essential concepts of lung volumes, capacities, and spirometric values. You'll learn not only the definitions, but also how these values change in different lung diseases. Understanding these basics is crucial for anyone studying respiratory physiology, preparing for clinical practice, or simply interested in how our lungs work. Let's start by laying out the objectives for this chapter, which will guide us through the key points you need to know. By the end of this video, you should be able to define lung volumes and capacities, explain key spirometric values like FEV1, FVC, and the FEV1-FVC ratio, and describe how these values change in obstructive and restrictive lung diseases. These objectives will help you build a solid foundation for interpreting pulmonary function tests in both clinical and academic settings. Spirometry is one of the most common tests used to assess lung function. It measures how much and how quickly you can move air in and out of your lungs. The test is simple. The subject wears nose clips and, after a full inspiration, exhales as forcefully and quickly as possible. This maneuver provides critical information about lung health and helps diagnose various respiratory conditions. Three main values are derived from spirometry, forced vital capacity, FVC, forced expiratory volume in 1 second, FEV1, FVC, FVC ratio. FVC is the total volume of air exhaled after a full inspiration, while FEV1 is the volume exhaled in the first second of this maneuver. The FEV1-FVC ratio helps determine if there is an airflow limitation, which is crucial for diagnosing obstructive and restrictive lung diseases. Forced vital capacity, or FVC, is a measure of the maximum amount of air a person can forcibly exhale after taking the deepest breath possible. It's a fundamental value in spirometry and provides insight into the overall capacity of the lungs. A reduced FVC can indicate restrictive lung disease, where the lungs cannot fully expand. FEV1 stands for forced expiratory volume in 1 second. It measures the volume of air exhaled during the first second of the FVC maneuver. This value is particularly important for detecting airway obstruction, as it reflects how quickly air can be expelled from the lungs. Lower FEV1 values are often seen in obstructive lung diseases like asthma or COPD. The FEV1-FVC ratio compares the amount of air exhaled in the first second to the total exhaled air. In healthy adults, this ratio is typically around 80%. A lower ratio suggests obstructive lung disease, where the airways are narrowed and air cannot be expelled quickly. This ratio is a key diagnostic tool in respiratory medicine. A spirometric tracing visually represents the forced expiratory maneuver. It shows the volumes measured for FEV1 and FVC and highlights the forced expiratory flow from 25% to 75% of the vital capacity FEF 2575. This middle portion of the curve can provide additional information about small airway function, especially in early obstructive disease. The peak expiratory flow rate, or PEFR, is the highest flow rate achieved during a forced expiratory maneuver. It's a quick and practical way to monitor airway function, especially in asthma patients. PEFR can be measured at home using a simple handheld flow meter, making it useful for daily monitoring and management. FEF 2575, or forced expiratory flow from 25% to 75% of the vital capacity, is the average flow rate during the middle half of the forced expiratory maneuver. This measure is more sensitive to changes in the smaller airways and can help detect early obstructive changes before FEV1 is affected. While FEV1 and FVC are highly reliable and reproducible, measures like PEFR and FEF 2575 can vary more between repeated tests. This means that, for clinical decision-making, FEV1 and FVC are generally preferred, but PEFR and FEF 2575 still provide valuable additional information, especially in certain clinical scenarios. Measuring lung volumes is another key aspect of pulmonary function testing. Unlike spirometry, which measures air that can be moved in and out, lung volume tests assess the amount of air remaining in the lungs after maximal expiration. This requires specialized equipment, such as helium dilution devices or body plethysmographs. To measure lung volumes, the participant typically wears nose clips and breathes into a device that uses helium dilution or sits in a plethysmograph. These techniques allow for accurate measurement of the air that remains in the lungs after a maximal expiration, which cannot be measured by spirometry alone. Lung volumes are the basic units of lung function and cannot be further subdivided. There are 4 standard lung volumes: tidal volume, TV, Inspiratory Reserve Volume, IRV, Expiratory Reserve Volume, ERV, and Residual Volume, RV. Each represents a different aspect of the air we move or retain in our lungs. Tidal volume, or TV, is the amount of air inhaled or exhaled during normal, relaxed breathing. It's the air you move in and out with each breath at rest, but it can also increase during exercise or other activities that require more oxygen. Inspiratory Reserve Volume, or IRV, is the maximum amount of air you can inhale after a normal inspiration. It represents the extra air you can draw into your lungs when you take a deep breath above and beyond your usual tidal volume. Expiratory Reserve Volume, or ERV, is the maximum amount of air you can exhale after a normal expiration. It's the extra air you can push out of your lungs after breathing out normally, down to the lowest level you can comfortably reach. Residual volume, or RV, is the amount of air left in your lungs after you've exhaled as much as possible. This air cannot be voluntarily expelled and is important for keeping the lungs inflated and preventing collapse. Lung capacities are combinations of 2 or more lung volumes. They provide a broader picture of lung function and include inspiratory capacity, IC, functional residual capacity, FRC, vital capacity, VC, and total lung capacity, TLC. Each capacity reflects a different aspect of how our lungs operate. Inspiratory capacity, or IC, is the maximum amount of air you can inhale after a normal expiration. It's calculated as the sum of tidal volume and inspiratory reserve volume, or as the difference between total lung capacity and functional residual capacity. Functional residual capacity, or FRC, is the volume of air remaining in the lungs after a normal, relaxed expiration. It's the sum of residual volume and expiratory reserve volume, representing the resting level of the lungs. Vital capacity, or VC, is the maximum amount of air you can exhale after a maximum inhalation. It's a key measure of lung function and is calculated as the sum of inspiratory reserve volume, tidal volume, and expiratory reserve volume, or as total lung capacity minus residual volume. Total lung capacity, or TLC, is the total amount of air in the lungs after a maximal inspiration. It's the sum of all lung volumes, residual volume, expiratory reserve volume, tidal volume, and inspiratory reserve volume. A diagram of lung volumes and capacities helps visualize how these values relate to each other. Each volume and capacity is represented as a segment or combination of segments, making it easier to understand the relationships and calculations. Pulmonary function tests can reveal 2 major patterns of ventilatory impairment: obstructive and restrictive. Obstructive diseases, like asthma and COPD, are characterized by narrowed airways, while restrictive diseases, such as pulmonary fibrosis, involve stiff lungs or chest walls. Each pattern affects spirometric values and lung volumes differently. In obstructive lung diseases, such as asthma or chronic obstructive pulmonary disease, COPD, the airways are narrowed, making it harder to exhale quickly. This leads to a reduced FEV1, a low FEV1, FVC ratio, and often an increased residual volume and total lung capacity due to air trapping. Restrictive lung diseases, like pulmonary fibrosis, are characterized by stiff lungs or chest walls. This makes it difficult to fully expand the lungs, resulting in a reduced FVC and TLC. The FEV1, FVC ratio is usually normal or even increased, as both FEV1 and FVC are proportionally reduced. Some patients may have both obstructive and restrictive features. In these cases, FVC and FEV1 are both low. The FEV1-FVC ratio is also low, and residual volume and total lung capacity can vary depending on the dominant process. A summary table can help compare the changes in spirometric values and lung volumes in obstructive and restrictive lung diseases. This makes it easier to recognize patterns and apply them in clinical practice. Asthma is a classic example of obstructive lung disease. During an asthma attack, the airways narrow, making it difficult to exhale quickly. Spirometry will show a reduced FEV1 and a low FEV1, FVC ratio, while PEFR is also decreased. These changes help confirm the diagnosis and monitor treatment response. Pulmonary fibrosis is a restrictive lung disease. The lungs become stiff and less compliant, making it hard to fully expand them. Spirometry shows a reduced FVC and TLC, but the FEV1-FVC ratio is typically normal or increased. Recognizing this pattern is key for diagnosis. Chronic obstructive pulmonary disease, or COPD, is another obstructive lung disease. It's characterized by persistent airflow limitation. With a reduced FEV1, low FEV1, FVC ratio, and often increased residual volume and total lung capacity due to air trapping. Neuromuscular diseases can cause a restrictive pattern due to weakness of the respiratory muscles. This leads to a reduced FVC and TLC, but the FEV1-FVC ratio remains normal or high. Recognizing this pattern helps differentiate between lung and muscle causes of restriction. In addition to spirometry and lung volume measurements, other pulmonary function tests can be performed for clinical and research purposes. These include tests for diffusion capacity, airway resistance, and gas exchange. Each provides unique information about lung health. Abbreviations are commonly used in pulmonary function testing. It's important to know what each abbreviation stands for, as well as its definition and clinical significance. For example, FVC, FEV1, RV, TLC, and PEFR are all standard terms you'll encounter. To recap, spirometry measures how much and how quickly air can be moved in and out of the lungs. Key values include FVC, FEV1, and the FEV1-FVC ratio. These values help diagnose and monitor obstructive and restrictive lung diseases. Lung volumes include tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. Each represents a different aspect of lung function and is essential for understanding how the lungs operate. Lung capacities are combinations of lung volumes and include inspiratory capacity, functional residual capacity, vital capacity, and total lung capacity. These capacities provide a comprehensive view of lung function and are key for interpreting pulmonary tests. Obstructive and restrictive lung diseases show distinct patterns in spirometric values and lung volumes. Recognizing these patterns is essential for accurate diagnosis and management of respiratory conditions. When performing pulmonary function tests, ensure the subject is in the correct position and follows instructions carefully. Consistent technique is vital for reliable results. Nose clips, proper posture, and maximal effort all contribute to accurate measurements. No test is perfect. Factors like patient cooperation, equipment calibration, and technique can affect results. Always interpret pulmonary function tests in the context of the patient's clinical picture and repeat tests if results are inconsistent. Let's review what you've learned. Can you define FVC, FEV1, and the FEV1-FVC ratio? Do you know how these values change in obstructive versus restrictive lung diseases? Reviewing these concepts will help reinforce your understanding and prepare you for clinical application. Many other pulmonary function tests exist for both clinical and research purposes. For more detailed information, consult the reference list or specialized textbooks on respiratory physiology and pulmonary diagnostics. Lung function tests are essential tools for diagnosing and managing respiratory diseases. Understanding lung volumes, capacities, and spirometric values is fundamental for interpreting these tests and providing optimal patient care. Thank you for joining us in this exploration of lung function tests. With a solid understanding of lung volumes, capacities, and spirometric values, you're now better equipped to interpret pulmonary function tests and recognize patterns in obstructive and restrictive lung diseases. Keep practicing and stay curious.